Okay, hi, I'm with Dr. Marc Pelletier. We're at the St. John Regional Hospital. We're in his office. I had this really interesting interview. I'm going to put Marc on here in a second here. But please read the interview below. Lots of good information for any leader in any sector, in any business. Give it a read. It's good stuff. So here is Marc. How are you?
I'm well, thank you.
Thank you very much for your time.
You're welcome.
I got a quick question for you around, you told me something very interesting about the importance of how you can, I think you said 80% when you're diagnosing something can often come just from how you probe, and I'm paraphrasing here.
Yeah.
10% and kind of in tests and 10% in the physical exam. Yeah. And I was just thinking about that 80% of how important that is, in business, in terms of how we kind of get at information, and just how important it is. And can you tell me a little bit about, what you learned around asking questions and that whole kind of piece in terms of patient interaction?
Yeah, and I think as a physician, when we go to medical school, that's what we're taught, is that about 70 to 80% of the time, based on history alone, you can try to diagnose the problem and you'll be fairly accurate. And that other things, physical exam, tests will provide you with that other 20 to 30% in terms of diagnostic accuracy. But I think that's a bit of a parallel for everything that we do in life, trying to listen to what the problems are, having time to really talk about those in depth, not rushing to snap judgments, really taking your time to try to make the right decision, asking open-ended questions, not trying to lead the interview with your patient into one direction or another. And if you really take the time, and I think you ask the right questions, the right open-ended questions, a lot of the times it'll lead you to that right diagnosis and what you're looking for. At least it'll put something in the lead, and then you have a much better chance of getting to your goal of figuring out exactly what's happening.
And do you think it's it sounds like it's a very important piece of your interaction with the client. Do you think it's understood kind of, and people have the skills generally to be effective there?
I think so, and I look at what I do in terms of heart surgery. For me, it's a little bit different, because when I see somebody, a lot of that has been vetted or done by somebody else. So when they come to me, I'm almost told exactly what the problem is. I think my family physician colleagues probably have the biggest challenge of all, because somebody comes in and you're starting at zero. You have no idea what they're going to say or what the problem is, and I think, like everything, some of us are better at it than others, and some of us do it well, some of us don't do it very well, and I think it's something that we're all coached on. We're all taught that in medical schools, and perhaps some schools or people do it better than others. But it's a huge part of trying to be, I think, a good doctor, is sitting down and really listening to what your patient is telling you, and trying to formulate all of those types of things into a concrete one-line diagnosis. And getting there is sometimes a real challenge, and I'm lucky. I don't have to do it as often as others, but right. I think that's a good challenge.
And just on that, on the challenge side, when you are faced with that, what are you finding is the biggest challenge to listening in a way you want to listen and ask the kind of questions you want to ask?
I think for all of us, it's time. Yeah. It's time. It's trying to have enough time. I think if the nature of the work is such that you do need to see a certain number of patients, you do need to get from A to B to all the way down, and sometimes you just don't have enough time to really sit down and spend maybe an hour is what you need. With some people will come in, they're very good, they'll answer your questions very promptly, exactly what you need to hear, and then others, it's really, and I think of sometimes some of our older patients, there's a real story behind, are you having pain during the evening, and it'll be like this 3-minute answer to try to get down to what you need, and sometimes finding enough time just to deal with that is to me is the biggest challenge.
Okay, well, I guess it's nice to hear that it's not just the business community that's struggling with time challenges. Thank you very much. It's been very informative.